Let's talk about possible solutions that people have when it comes to frozen shoulder.
Well, first thing and foremost, you have to find a practitioner that dry needles. The dry needling is a key component. I think that's when the game changer moment happened for me. And you can massage it, you can do all this myofascial work, but you're not really going to get anywhere because the brain and the muscle have programmed to stay tight. You have to break that constant output, input, output, input. The best way to do that is to dry needle the trap first. You can't go forward, you can't go to the side, but you can't drag your thumb up your middle of your back. I realized that there was like a really good way of treating the problem. And it didn't have to take more than 3 months, which was great. Because remember, like during that thawing phase, it can take 1 to 3 years.
So you have tried things that didn't work, tried things that work. And I want people to know, patients and providers, what is it that actually works, that makes the difference to take, a possible 3-year recovery and then compressing it into just 3 months. So today we're going to talk about frozen shoulder. What can you do if you have frozen shoulder? What can be done if you're a provider and you have a patient with frozen shoulder and you're looking for solutions on how to get them as good as possible, as fast as possible? We're going to talk about what is frozen shoulder. We're going to talk about maybe some exercises, maybe some stretches, and also things that you can do in terms of treatment options, because there are things that work and there are things that tend not to work. So let's talk about giving people shortcuts. I'm here with an amazing guest, Dr. Lily Moezi-Vaziri. She's a chiropractor in Herndon, Virginia. And Dr. Lily, welcome to Polish Your Life.
Thank you for having me. I'm excited to be here.
I'm excited to have you here. So let's talk about frozen shoulder. Maybe let's start with what is frozen shoulder, because not every shoulder pain equals frozen shoulder. So let's talk about what it is.
So frozen shoulder is kind of like a weird issue that it pops up. Frozen shoulder is also called AKA adhesive capsulitis. It's just like the tendons and the labrum and the muscles just like tighten up. And it's like they tighten up over lack of use. They tighten up because you used it a lot and then you stop using it. It tightens up just somehow out of nowhere. So they have like 3 phases of it. It's called freezing, frozen, then thawing. But basically, when you kind of go from the tightening part, it's painful. And then now it's stuck. And then they have this idea that when it thaws out, then things will get better. But you may need some cortisone shots, corticosteroid shots. But that can take up to 1 year to 3 years. So not using your arm for potentially 1 year to 3 years is kind of outstanding to me, that people think like that's okay. And usually frozen shoulder, like for women, just like hypothetically, they can't take their bra off. Like they can't extend back. Let's say you have a glass on the top shelf, you can't use it. So you'll kind of do this like shoulder raise as well. Or just even like you want to grab something out of the back of your car, you can't extend back. So those are like the 3 real main range of motions that you'll see, is that you can't go forward, you can't go to the side, but you can't drag your thumb up your middle of your back, again, to trying to take off your bra. So when I started noticing this more and more, and it's really painful at nighttime, like you can't sleep. A lot of patients will tend to put like a pillow under to prop it up. And you'll have this very much of like a searing pain, like down the arm. So, going through chiropractic school, like you knew what it was, and they would just say like stretches and massaging, they're doing like myofascial release, and it'll eventually get better. But no one really like kind of talked to you about the extent of how painful it can be and how emotionally limiting that puts on your life. I mean, again, you can't, like, even just to as simple as to brush your hair, you have to bend your head to brush your hair, even to wash it. So it's kind of dehumanizing, if you will. So over time, I really worked on perfecting the protocol. And it was a lot of trial and error, you know, that's what practice does, real life practice. And I realized that there was like a really good way of treating the problem. And it didn't have to take more than 3 months, which was great. Because remember, like during that thawing phase, it can take 1 to 3 years. But it's not fun. I'm going to be honest with you. Like patients are not always in the happiest mood, but they just, once they see the results, they're like, okay, I'm willing to come back again. So that's how I kind of came to really enjoying helping people with frozen shoulder.
Yeah, I remember, and this is awesome because if a lot of people have it, and this can take, like you mentioned, up to 3 years. And what if it doesn't get better? I cannot imagine a woman not being able to put her bra on, you know, just, you know, for a period of time, but not to mention months or years. And then, you know, the ways that it can affect the life. So when we talked off camera, right, you mentioned, I'm like, you know, which topic could we record about that you would feel very confident in and comfortable talking about? And you said, oh, frozen shoulder. And I'm very, very curious, what exactly is the secret sauce here? Because obviously you have tried things that didn't work, tried things that work. And I want people to know, patients and providers, what is it that actually works, that makes the difference to take, you know, a possible 3-year recovery and then compressing it into just 3 months, because in that context, it's actually pretty fast. So let's talk about possible solutions that people have when it comes to frozen shoulder.
Well, first thing and foremost, you have to find a practitioner that dry needles. The dry needling is a key component. I think that's when the game changer moment happened for me. When you have frozen shoulder, again, adhesive, it's tight, it's capsulized, it's like capsulated. So there's not a lot of movement happening, and you can massage it, you can do all this myofascial work, but you're not really going to get anywhere because the brain and the muscle have programmed to stay tight. You have to break that constant output, input, output, input. The best way to do that is to dry needle the trap first. And a lot of times when you have frozen shoulder, patients will get headaches. The head starts tilting this way because all these muscles are being pulled, right? So you dry needle the trap, and you do that for like monotony, like for like 3-4 visits. Okay, so you should be able to loosen things up within like a week and a half, maybe 2. And that's pretty common for moderate. Severe patients, obviously, like you're going to have to talk about, like, we're going to take this visit by visit, you know, because it's really bad at that point. That's even like counting, talking like maybe this might go to surgery, maybe. But again, you have to be realistic with your patients. So once the trap is finally released, patients noticing that they can move, and sometimes they'll start noticing like one range of motion, maybe this one's better, maybe the one out to the side, maybe that one will get better. And this is like the weird part too in this, is that as certain range of motions get better, and there's always one range that just decides to be like the problem child. People need to know that. So it's not like all 3 ranges go perfectly, you know, check mark, check mark. So anyways, you do that work, and then now the patient's like pain has calmed down. This like referral pain is reducing down, not perfect. And also too, I'm very honest, I'll tell patients, like, if you need to take over-the-counter pain meds, please do so, because they need to sleep. And if you're not sleeping, you're not healed, right? So then now from like visit like 2 to, let's say, week 2 to about week 5-ish, okay, you're doing a ton of work in the armpit. So when you ask the patient to like literally bring your arm up, okay, they get kind of stuck. They can't move it further. So you're trying to get under the scapula and between the ribs, right? So the subscapularis, you're really trying to open it up. You'll notice, like, over and over again, anyone with a frozen shoulder, your hand is sitting more on the surface. You can't dip in. And when you can't dip in, then you're not going to get anywhere. So this is where you tell the patient, like, I know this is going to hurt. Hang with me. And you do a count. So you go, I'm going to work on it 5, 4, 3, 2, 1. Because also too, that will help the patient not to have anxiety because there's so much pain, right? So you do that, you do like you really dig in, you work on that teres minor and major. And then eventually you start noticing like your hand is kind of like sneaking into the cave between the scapula and the rib cage. Next thing you know, you ask them to sit up and they'll see if the range of motion is getting better, right? So that takes about some time because that's like the meat of the problem. That's the heaviest part. Once you kind of get through that, then all of a sudden the patient goes, but I'm still having like a little trouble. And this is where I think a lot of practitioners miss out on frozen shoulder. Because the frozen shoulder was so limited, the elbow starts losing its capabilities of proper movement too. And also too, it will get so much swelling from all the stuff happening, it traps into the elbow. And so it's almost like you're getting a nerve entrapment, not because it's trapped within like the joint or scar tissue, it's just because it's so swollen, right? So next thing you know, you're working on the bicep, you're really getting into the nooks of the cranius between the brachioradialis and the radial and the ulnar, the whole shebang. And you're doing more like a myofascial release. And then the patient will be like, whoa, I didn't know it was that painful in there, time and time again. Next thing you know, they're like, wait a minute, I can take my bra off. And they're like, whoa, I can bring this up a little bit more. Or if I go to the side, but it's a little hitched here, right? Let's just say that for an example. Then you stay there, but now you have to sequence the elbow to the shoulder, but also to the neck. And then that is when you start incorporating your exercises.
This is really interesting because you mentioned that, yes, we are treating the shoulder, but you're also mentioning that you have the nerve that is coming, you know, from the neck actually through the shoulder, elbow, and that's why you're talking about the biceps. So you would treat not only the shoulder itself, you would work a lot under the armpit, like you mentioned. You will treat the shoulder itself. You will also treat the elbow and work on the bicep as well, which is very interesting because instead of looking at the isolated issue just being in the joint, you're looking at the surrounding areas. So when you mentioned dry needling at the beginning, so for our providers watching here, right? So if we have dry needling providers, which a lot of chiropractors right now are trained in dry needling as well, or have a provider who is doing that in the same office. So you would recommend, you mentioned 3 to 4 visits at the beginning, you would dry needle, and actually you would dry needle the traps, right?
Yes.
And then
Absolutely.
after that, the treatment involves the other things that you mentioned, but without dry needling, or you would continue dry needling?
I wouldn't continue dry needling at that point because one, you really don't want to get dry needle in your armpit. It's like, it's pretty intense, you know? So it's for that, it's more like a mental thing for the patient because again, they're not sleeping well. They're in a lot of pain. You know, daily life is really tough. Like, again, imagine you can't put on your own shirt, you know, you have to do this weird snaking thing. So you're overwhelming them, and that neurological and working on that sympathetic system sometimes can make the person anxious. And that's why I was saying you want to count it out, the 5, 4, 3, 2, 1, because it becomes more rhythmic to them and they can follow that. They know there's a beginning and there's an end. Sometimes with needling and you're like in this weird position and you can't really move your arm and you got all these needles under there. I mean, it can be a little like mind playing there.
I can imagine. We just interviewed Ryan Dinner, and we were talking about acupuncture, and we were talking about, you know, the acupuncture needles, which is, you know, essentially the same needle,
Same medium,
and they don't hurt. And then I was giving an example of my mom who actually sneezed during acupuncture session, which is not a good idea. But coming back to the more serious conversation here about, you know, even trying to imagine having needles being put in, even though they don't hurt, it's just probably a weird feeling to have them in your armpit, like you mentioned. So you would work your way kind of like down from the trap starting with dry needling, then we're working the way down. And you mentioned that you have different phases of frozen shoulder in general, but you also mentioned that you have different type of people. So some of the people are going to be more responsive to treatment. Sometimes that frozen shoulder will be a little bit more stubborn, right? So I wanted to ask you also, what can, at the same time, what can the patient do at home to improve the treatment? So let's say you have, how often would you do the treatment? When you say 3 to 4 visits at the beginning, you would do the dry needling. Is that 3 times a week? Is that every day? Is that 2 times a week?
The only time I like my customarily, unless a patient is really acute in pain, I only do 3 times a week for them. But most often I'm taking care of patients that are like chronic. And so I'll do twice a week because again, we live in Northern Virginia. People are hustling and bustling, you know.
Here in Maryland too.
Right. Like it's just so it's just like, and like with the current state that we're in, people are fatigued. And I want people to really know that they have some space to breathe between these intense treatments. So I do like twice a week, you know, and they know that. But I told them at any point that you feel that you can handle more, please tell me and we'll go, you know. I'm very cautious that a patient, even though like they're in pain, but they actually enjoy coming in, you know. This is a place to like let go, a place to feel safe and not to feel like just a number, you know. And I think with frozen shoulder, you know, many times I'll have patients that will come back for a PT and they're like, they just gave me exercises. And I was like, well, how long were you there for? Oh, for like 3 months. And I was like, okay. So,
And
but it's
still
not
coming,
the PTs.
still
Yeah, but it's
coming
not
with the frozen shoulder problem, right?
Yeah, and it's not a lot of the PT's fault because sometimes the PT just has to follow the script. You know, that's just only the area they're allowed to. And so sometimes it's frustrating when, you know, frozen shoulders, like it's such an awesome treatment plan. If you follow this way, you feel so rewarded because it's healing faster than what is expected. But the thing is like, you need like a neck script, you need a shoulder script, you need an elbow script. And so this patient has to go back and forth. So sometimes you're getting people at the like frustrated point. So again, you're trying to make them comfortable.
Yes, I can imagine how the patient feels because like you want your shoulder to just get better. And sometimes if you are in pain, you're like, hey, let's do an intense treatment program, but just get me out of pain. And if you're doing something intensely and following a PT regimen and not getting better, I can imagine that can be really, really frustrating. So help me understand, what is the patient doing in between the visits? Do you advise them to just relax, take it slowly? Do you advise them to work out, stretch, maybe certain type of movement, certain type of equipment they need to buy? Like you mentioned, foam rolling could be a good idea when we talked off camera. So let's talk about what the patient is doing in between the visits, please.
For sure. So when initially when the patient is being dry needled, I ask them to do nothing. Just like relax, because I need the dry needling to continue to do its thing. Meaning, even though you're dry needled, days after, the muscle is still relaxing, right? So I don't want to aggravate that traps. Just let it be. Also, too, if I'm under the armpit and I'm still not getting anywhere, I'll still ask them to kind of relax, right? Because they can't move. But once I start noticing my fingers are going in between the scapula and the rib cage, then we start implementing exercises. So it's very simple. It could be just walk your hand up onto the wall, find that sticky spot and just lean into it a little bit. 5 seconds, come out, walk it down. The reason why you got to walk it down, because if you drop your arm, the arm will get seize up and it hurts. Because even sometimes walking up, you can see the patient is like, okay, and you'll see the shoulder go with it. So that's one. The other thing is the foam rolling. When the foam rolling, I will ask the patient not to do it on the ground, because let's say you're like top heavy and you're trying to put your arm over and your whole weight is between the floor and the foam roller. Oof, it's uncontrollable pain. So I asked them to like put it up against the wall, perpendicular to the lat, and start finding the spot, you know, go with it like 5 strips, And then when you find a sticky point, go over and back on the lat. And then once the patient is more mobile, they can grab the hand and kind of like pull into the foam roller. Another great exercise as the patient gets better is getting like a baby kettlebell, 5 pounds, right? And you just sit like, even just let's say I'm sitting on the chair and you're just kind of like swinging it back like a pendulum, right? Kind of like a rusted door, like you just kind of like go back and forth. Eventually that rusted door will like open, you know, something like that. That's another great one. And the other good one is when the patient is supine, so they're on their back, and they just have like a 2-pound dumbbell. Like that's how sometimes these patients can be so sensitive. Laying on the back, and you said just bring your arm back, and once you hit that 3-4 pain level, just hang there for a second, and then use this muscle to get the arm back. That's the part of the sequencing, because a lot of times after you've been in pain for so long, you don't even know how to operate the joint, right? So I asked them to isolate and use the shoulder with the movement. Eventually you start noticing the patient's like, oh, I'm getting better and better. And then another like really, really good one too is like what we learned in chiropractic school, put the towel so that the patient can pull it up, right? Pull it a couple seconds so she can probably take her bra off. So like things like that. Those are like my 5 primary, I think I said 5 primary exercises. And then there's like, you know, you have to like change certain things up, because let's say a patient has, you know, other issues like low back issues. So you'll figure things to accommodate and specify a movement so that patient can isolate here without aggravating anything else. So just kind of cleaning up, if you will.
That is awesome. And I love it that you're adjusting and tailoring the treatment plan, not only to frozen shoulder as a condition, but also to any individual patient. And, you know, and not everybody has the same pain threshold. So some people will be able to move, you know, with the therapy a little bit faster. Maybe with some other people, you will have to be more gentle. Some people will be more willing to exercise. Some people will not be. Some people will be like me, is like they will be just anxious to go back to the gym as soon as possible. And then if you get hurt in the gym, you're actually going, you know, one step forward, 2 steps back. So that's also a good thing to know, that you would do a sequence of different events, and then while they're different treatments, and while they're still being treated, until the moment that you say that you will be able to see that joint really releasing a little bit and letting you go in, that's the moment when you prescribe exercises at home instead of starting right from the beginning. So that's, I think, a small change that maybe some of the other providers can use in their treatment programs that may be very beneficial. So thank you so much for this, because it's super important to collaborate. And I always talk about, you know, that situation that we have patients that go from one place to another. They go from doctor to doctor, follow recommendations, or in this case, from a physical therapist to a chiropractor, and then maybe a personal trainer. And there's a lot of people, everybody is the expert in their field. And at the same time, you're frustrated as a patient because you're still not better. So sharing the knowledge, sharing some tips that may or may not work for a particular person, but now you can try it, I think that's very valuable. I have one more question to you, and that's in terms of, that's going to be talking about a situation where the patient actually did not get better because there is something happening with the joint. Maybe there is a reason somewhere else that the joint is just not responding well to treatment. At which point would you refer out, and to what type of practitioners are you referring? Are we talking about pain management to maybe have some corticosteroid shots? Maybe we're talking about surgeons. Maybe we're talking about different types of therapies that you are considering. I'm just curious, where do you go if there is somebody watching and they're treating a patient, they tried it all, they applied what you mentioned, and they're still not doing better? What would they do?
I would go for the steroid shots first and see how that works with more pain management. And then maybe that can allow the patient to do more therapies. The only way that, like, I think if a patient should have surgery is if there were tears and those tears did not heal properly, and that what made the joint so tight go down that route. Because the thing is that it's adhesive capsulitis. So when you cut in there, you can clean it up, but it doesn't mean that like loop might happen again. So if that's the route the patient has to take, and I would highly, highly like tell the patient that like, if it happened in this joint, it could happen to the other joint. It's in you for this to happen. It's a phenomenon. Why does it just get so tight and seize up? You know, it's really unknown, but you have to like know, you have to express that. Like, go do what you do. We did our best that we could, but you need more pain management, but don't stop doing your therapies. I just want to like put that there.
Yes, so it's one if it's needed, it's one in addition to the therapy, not instead of therapy. So that's
exactly.
I know our friends, chiropractors watching this, they know already, and I know most patients know. But sometimes it's just, you know, people are looking for that instant gratification, right? And everybody's like, hey, I text somebody, they reply back. I want to have something here by my, door. I will just order it on Amazon and it shows up. So people are used to that right now. And I think it's a blessing and a curse at the same time, because sometimes we need to have a little bit of patience to just allow the process to work and trust the provider, the great provider, because not every provider is great, and we all know this.
You want to tell you, frozen shoulder will test your patience. That's for sure. It will test your patience.
What definitely helps here is the type of personality in addition to skills, because I will tell everybody watching the video is Dr. Lily she has this ability to make the treatment floor sound like it's like the best party-like atmosphere. Patients are laughing, they're smiling. So while you're treating them, and I know they need to go through some level of pain in that, it definitely helps to have a personality that will just say, hey, listen, we're going to do something. It's going to be a little crazy, but I'm going to count to 5. And then on 5, we're done, right? So this is really good to find a provider who can actually walk you through the treatment as you get treatment, instead of just giving you the treatment, because it's all teamwork. It's both.
Yeah, you're very vulnerable. You know, your hand is in someone's armpit for like a couple of minutes, you know. It's not like you're sitting there and you're looking at the person like, so, like you have to have a little humor in it, and it's painful. And I think a lot of people kind of forget, like, it sucks, it's not fun, but you can make it somewhat fun. And in the medical world, it's very heavy. You know, all of this is so heavy. You know, no one wants to see another human being in pain. You know, we're tribal people. So I always wish when I would to be taken care of, if something were happening to me, I would have someone that was fun, but let's get the job done, like goal oriented. That's that's my motto.
I love it. I love the motto. So everybody watching this, patients and providers, if you want to connect with Dr. Lily Moezi-Vaziri, Dr. Lily, where can people find you?
My office name is Glide Chiropractic Care. I'm new to being a business owner, 5 months, but I've been practicing for 16 years. And so finally pulled the trigger and decided to go on my own, and here I am. If you ever want to look at the things that we do, hours, all of that, you can go on www.glidechiro.com. And my email's there, so you can always email me, and I'll be more than happy to chat with you. Absolutely.
This is awesome. So thank you so much for the tips today and for the interview, for all the positive energy, along with very good advice. And at the same time, we are telling everybody we are not giving here medical advice. Let's be very, very clear. This is always teamwork, and this is not in place of your own healthcare provider who is treating you, but this is in addition. We are sharing information. We are making sure that providers collaborate. And if you're looking for, even if you're in California, if you're in a different country, if you're looking for an expert to collaborate with when it comes to frozen shoulder, you can connect directly with Dr. Lily Moezi-Vaziri. So thanks so much, and thank you for watching. All the best and take care.
Thank you very much.
Thanks. Bye.